Welcome to Accessible, the podcast that opens the door to disability leaders and their ideas. I'm George Gatto.
And I'm Amelia Reigard.
We are doing something a little different in this special series called Voices of the Network. Over the next few episodes, we will highlight university centers on disability, which are currently facing funding uncertainty in the proposed 2026 federal budget.
We'll explore how these programs came to be, their bipartisan roots in the Developmental Disabilities and Bill of Rights Act, and the impact they have on people with disabilities, families, and communities across the country.
Through conversations with national and local leaders, trainee alumni, and professionals, we'll shed light on the real-world value of UCEDS, LENS, and other DD network programs. These are stories of leadership, innovation, and impact.
We are kicking off this series with Sandy Root-Elledge, the Interim Executive Director of AUCD, the Association of University Centers on Disability, a national advocacy and technical assistance center for university centers on disability. She is the former director of the Wyoming Institute for Disabilities and founded and directed the state of Wyoming's Assistive Technology Program. As the parent of 2 adult children with disabilities, her lived experience is woven into all her work and partnerships. Her breadth of knowledge will help us understand the landscape of disability policy, how we got here, and where we're going. Voices of the Network starts now.
All right, well, we are very excited to have Sandy Root-Elledge joining us today. Sandy is the Interim Executive Director for the Association of University Centers on Disability. And so we are having our special start. She is beginning our special issue on, what are UCEDS and LENS and IDDRC. So this is going to be great. So welcome, Sandy. We're so glad to have you here.
Thank you, George. Thanks for the invitation.
Before we jump into all that, let's find out a little bit about you and just how did you get into the field of intellectual and developmental disabilities and ultimately end up in your current position?
Well, like many people, I'm entered the field because our 2 children have developmental disabilities. They are now adults in their 30s. And then I was asked by Senator Ted Kennedy to speak at a forum. And I did that when our children were very young and then decided, well, I think I need to legitimize my comments. So I decided to get into the field and learn all I could about the field.
Yeah. And I saw that you had began in assistive technology. Is that right? I didn't know that before now.
Well, sort of. I started at Wyoming's University Center of Excellence on Developmental Disabilities, the UCED, Wyoming Institute for Disabilities, in 2004. I have experience in healthcare prior to that, and my academic background is in sociology and applied research. And then with the first program I had at the Institute was the State's Assistive Technology Act program. So I started as the coordinator of community education and then became an associate director, interim director, and then director of the UCED for the last 10 or so years.
Yeah. Okay. And then, and so now you've kind of stepped into this really big position of at such an interesting time at AUCD. So thank you for that. I appreciate it.
Well, thanks. Yes, I retired in August and they sought me out in November. So I hadn't quite left the field yet. So I still had some relevant information.
What a retirement gig to accept, Sandy.
I was still on terminal leave from the university all the way through January, so I wasn't really gone. So
They got you at a good time then.
there.
Well, so let's talk a little bit about our network. And so as you probably remember, Sandy, our primary audience are LEND students, leadership, education, neurodevelopmental disabilities, and we do this podcast in partnership with our Missouri LEND. And so, just to help our students understand, can you talk a little bit about the Developmental Disabilities Act and its origins?
Well, prior to the Developmental Disabilities Act, which was signed into law in 1963, and then most recently updated in 2000, individuals with developmental disabilities were largely excluded from society. So some were living with their families and often without services or education or supports. And then many were living in large state-run institutions, and these were often underfunded and understaffed. There were also reports of abuse and neglect in some of the institutions. So as everyone may know, President John Kennedy's younger sister, Rosemary, was born with intellectual disabilities, and their parents had established the Joseph P. Kennedy Foundation in 1946, going back quite a ways now. And that sought to prevent intellectual disabilities by identifying causes of what was called mental retardation at the time. I won't continue to use that term, but just setting the stage. So, stemming from the family's work, President Kennedy convened a 27-member panel on intellectual or developmental disabilities. I will use that term interchangeably. In 1961. So the panel members included clinicians, researchers, there were clergy members, educators, and advocates who were all working in the field of developmental disabilities. And the panel's charge was to make recommendations that would help to identify the causes, preventions, and appropriate interventions related to intellectual disabilities. And President Kennedy urged the panel to think and plan boldly. So then he used the panel's report, sorry. So President Kennedy used the panel's report as a blueprint for a special message to Congress in February of 1963, during which he announced what was referred to as the bold new approach to intellectual disabilities. He recommended new programs for maternal and prenatal care, initiatives for moving individuals out of institutions and into community-based agencies at the time, and then plans for the construction of university-based research centers that would develop and provide diagnostic, clinical, and treatment services. His plan also emphasized the importance of special education, training, and then rehabilitation as well. So initially, a Social Security Act amendment was passed that incorporated many of the panel's recommendations and provided planning grants for states to update their intellectual disabilities programs. And the amendment included increased funding for prevention through maternity and infant care. And so the planning grants really were designed to move people out of institutions, as was part of the recommendation. So then 2 weeks later, on October 31st, 1963, the Developmental Disabilities and Bill of Rights Act, which is what it's called, also known as the DD Act, was signed into law.
That's a really great background, Sandy. I think it's also important to note that there was really broad support across Democrats and Republicans back in 1963 as sort of reflecting a new national consensus to move from institutions into community-based living. And then in 2000, that the bill was reauthorized unanimously in the Senate and without any objections in the House. So there was really broad bipartisan support both times this bill was passed and reauthorized back in 2000.
Right. I mean, the act has consistently received strong bipartisan support. And the belief is that the Act addresses the well-being and human rights of a large population of peoples, and that disabilities is not a partisan concern, it's a common concern.
And what do you think are some of the important parts or provisions of the DD Act?
Well, I would say that the DD Act represented changes in thinking about intellectual and developmental disabilities. And this isn't just my perspective, this is long held beliefs. But the tenets of the Act are rooted in the understanding that disability is a natural part of the human experience. That's one of the pieces. It also emphasizes the rights of individuals with developmental disabilities to live independently, to have choice over their own lives, and to fully participate in communities as they choose. And then the Act initiated new programs and the directive to move from institutional care to community-centered agencies, as I mentioned before, as well as for the initial construction of research centers for diagnostics, clinical, and service treatments. So this was a dramatic shift from the prior focuses on building and staffing buildings that were institutions, or keeping individuals secluded in the homes of their families. So the result of which, excluded individuals from large communities.
And then, I mean, so based on that, then how do you feel like or maybe you don't feel, it's just what you know, but how did the DD Acts come into being or I'm sorry, the DD networks come into being under the DD Act?
Yeah, oh, sure. The state DD networks. Well, the initial goal of the DD Act was to address problems in state-run institutions for people with disabilities. And over time, the goal has evolved to, well, I'm going to quote the Act, assure that individuals with developmental disabilities and their families participate in the design of and have access to needed community services, individualized supports, and other forms of assistance that promote self-determination, independence, productivity, and integration and inclusion of all facets of community life. So while that's a mouthful or a lot, it really is to make sure that individuals and families have a say. So to achieve that goal, the DD Act authorized 3 programs that operate collaboratively in each state and territory, known as the state DD networks. And these include USEDs, DD councils, and protection and advocacy programs. And each of the programs have unique roles, yet they coordinate together to address state needs. So I can talk about the individual programs if you'd like.
I think that would be good. We've gone over some of this in the past, like for instance with our state DD council director here in Missouri, but I think the update would be nice.
Okay, all right. Well, USEDs are University Centers for Excellence in Developmental Disabilities. They serve as bridges or liaisons between university teaching, training, research, and program development to communities that support individuals with developmental disabilities and their families. And I use the term communities throughout this pretty broadly because it could be education, it could be healthcare, but it could also be a geographic community. And right now there's 68 USEDs, one in every state and territory. And then the state networks include the state developmental disabilities councils, or DD councils, and they develop and implement a statewide plan to address priority areas relevant to individuals. So they pretty much identify the needs, and then through a variety of activities, then develop programs or ways to address those needs. And as I said before, and in collaboration with the USEDs and PNAs. So right now there's 56 state and territorial DD councils, and at least 60% of every council membership must consist of individuals with developmental disabilities or family members. And then the third leg of the stool are the state systems for protection and advocacy of the rights of individuals. And they develop and implement programs that protect and advocate for individuals with developmental disabilities. So there are 57 state and territorial PA programs, P&A programs, including a Native American consortium.
Oh, cool. I didn't know about that. See, this podcast is good for me too.
Everyone's learning something today. Sandy, could you talk a little bit about, so you're the interim director of AUCD, the Association of University Centers on Disability, like George kind of started off introducing you as. Can you talk about what AUCD's role is related to the DD Act?
Sure. AUCD is the Association of University Centers on Disabilities, as George said in the introduction. It is a national or association of network members that include UCEDs, LENS, and you know what LENS are, and IDDRCs. So I'll just go back. LENS are leadership education and neuro and other developmental disabilities programs. And IDDRCs are intellectual and developmental disability research centers. So the association supports the centers with their research, training, education, and service so that together, AUCD and the large network can promote quality of life, health, and well-being of people with disabilities. So at the national level, that's what we do for members. So we support members, and we also provide technical assistance. And then at the national level, AUCD collaborates with national associations for the councils and for the PNAs to advance all centers for our membership organizations. So we work together at the national level, and then we support the individual programs as well.
Yeah. So you mentioned the LEND programs, and can you talk just a little bit about what they do or what they provide that's different from those DD Act programs, like the UCED, the DD
Sure.
Council, and the PNA?
Sure. The LENS are programs that aim to directly improve the health of individuals with autism spectrum disorder or other neurodevelopmental or related disabilities. Over time, over the last 10 years, there's a real focus on autism. And LEND trainees come from a variety of disciplines, and these are graduate students or sometimes practicing professionals. And they represent the next generation of clinical research and community leaders in the field. So, as I said, they come from a variety of academic disciplines, and they receive training in interdisciplinary care or disciplines and learn about person-centered and family-centered care across the lifespan. And their learning is rooted in culturally held beliefs and values. So it really is a focus on family and person-centered care from that perspective.
Yeah.
I'm sorry, did you have?
Well, I was thinking, I'm sure you've heard the saying, if you've seen one, you said, and I wonder if that's the same for LENS. Like, are they, they have a common mission, but they're all a little different, or how are they structured around the country?
Yes, they are all different. There's 60 LEND programs, and they're members of AUCD. And they were established in the mid-60s alongside the DD Act programs. So to train fellows in interdisciplinary care of children and youth. But yes, they all look different. And my background as the director of the Wyoming, UCED, our LEND program, we collaborated with Utah. So it's the Utah Regional LEND, and it's a cohort of 5 different states, mainly because 4 of us don't have medical schools. So it really allows us to provide that kind of training in rural communities where it wouldn't otherwise exist.
Wow. So, I'm when I started early in my career here at the UCED, I helped George do the evaluation for our Missouri LEND program. And I think I was always impressed by the different disciplines of students that were coming to those Friday clinics and listening to those lectures and getting the clinical experience. And just thinking about, I like how you phrased it, that's the next generation of our clinicians that are getting the training they need. What's the latest science and research on these neurodevelopmental disabilities? What's the best way to work with families? And thinking of all the different, target populations out there, like you're saying, rural areas, where these clinicians are getting that added expertise on top of their discipline, what they're learning in social work or what they're maybe learning in OT or speech therapy, right? It's really a huge value for those students and the communities that they're going to go serve.
Sure. And then learning from each other. So learning from outside of their own discipline and learning how to provide interdisciplinary care.
Yeah. Speaking of that, I mean, that is one thing that we hear every year in our evaluation is just how much the students like that interdisciplinary approach and enjoy kind of engaging with people who are whose fields they may not be that familiar with, including I think a lot of LENDs are doing this, maybe all LENDs, but our LEND now has always at least one, and usually multiple family members and self-advocate trainees as well.
Mm-hmm. Yes. Yes, the Utah LEND does it well. I think most do. Yes.
Yeah, I think it's fairly common.
Family or individual driven clinics as well.
Mm-hmm. Yeah. All right. Well, so jumping on then to our AUCD network, we have the IDDRCs, and these people always intimidate me a little bit because they're scientists and they're doing really, at least at our IDDRC, and I'm sure the others are the same. They're doing this just amazing research, brain research, and so I'm always in awe of them.
George, they intimidate me as well. and we did not have an IDDRC in Wyoming. We wouldn't even have the facilities or we don't have a medical school either. So sure, a little bit about them. There's 15 IDDRCs. Those are intellectual and developmental disabilities research centers, and they are also members of AUCD. Just like the LENDs, they were established in the 1960s alongside but not directly through the DD Act. They were established through Congress. And they were established to prevent and treat developmental disabilities by looking at biomedical and behavioral research. That's why this is beyond my scope. But so interesting. Collectively, their overarching goal is to build upon new knowledge and identify how alterations in biological processes may directly impact individuals with developmental disabilities. So scientific and clinical findings of the IDDRCs are key drivers to developing cutting edge tests for diagnostics, creating new therapies, and improving assistive technologies for individuals with disabilities. They ultimately strengthen the research infrastructure and advance understanding of disabilities because they're also providing training in the next generation. So research training, mentorship, and support for emerging leaders in the field. And so by identifying real life tangible solutions, the work of IDDRCs help to empower people with disabilities to live independently and participate fully in their communities if and how they wish. So quite aligned with the tenets of the DD Act.
I remember when we, a couple of seasons ago, we interviewed Chris Garnett from Missouri's IDDRC, and she was talking about genetics research and neuro research. And I just remember there were so many big words. We're all here from the social science disciplines. right? We're used to talking about human behavior theories, but she was talking about genetics, and I was thinking, I got to look up all these words later because I don't know what all of them mean. But I was so impressed by her knowledge. So, um, yeah. I wonder if we could talk a little bit. We've kind of introduced the three programs that make up the AUCD network, all the university work that is going on around the country around disability. And can we talk a little bit about the kind of reach and impact that you see the AUCD network programs are having nationally?
Sure. USEDS and LENS are and I'm really going to talk about just those two, but they're required to report output and outcomes data. And AUCD manages that data system. It's called NIRS, the National Information and Reporting System. And so I just pulled some data from last year's report. And together, again, this is just the USEDS and LENS, but they, in fiscal year 24, they served more than 513,000 people. Close to 1 million people received continuing education. So that's continuing education where they received credits in their discipline. 4,300 students were trained in more than 47 disciplines, such as audiology, physical therapy, social work, dentistry, child development, early intervention, among others. And then more than 177,000 families received clinical services, such as diagnostic evaluation for developmental disabilities, therapies, and more. So that's some of the numbers. It's pretty impressive when you think about the power of our network.
Oh my goodness, it is. And we see our numbers, and just FYI, Sandy, Amelia leads our NEARS team, so she's very familiar with all of this. And
Yeah, thank you. No, it's definitely fun to look at the numbers as our different projects are reporting what they're doing, the different trainings that they're hosting, right? The webinars that they're doing, the conference presentations, and being able to see just the reach and impact we have here in the state of Missouri and in our neighboring states. But to hear some of the numbers coming across all of AUCD is exciting. So thanks for sharing some of those. And that makes me want to put in my data for next year, Sandy.
Hey, good.
We got our 2025 report coming up. Go ahead. Sorry.
No, I just wanted to add, it's really powerful. I mean, and when you think about it, but also for legislative and lobbying purposes, to be able to say that this network that is statewide and has research, evidence-based information, has these kind of outputs. That's very strong messaging.
yeah, I agree. So, do you have any stories that you can share that sort of illustrate the long-term value of the AUCD network programs?
Sure. I pulled these from our report, but I also have one from Wyoming that I'll share second, perhaps. But one is from the Rochester Medical Center in New York, and this is a boy named Ian, age 2.5 at the time, who was diagnosed with autism in 2007. And his mother brought him to the Golisano Intellectual and Developmental Disabilities Institute, which is part of the medical center, and reported feeling overwhelmed and wondered how she could protect her child and herself. And a quote from her is, "As a parent, you recognize that the world is not set up to support our kids, accept our kids, and love our kids." And certainly as a parent, that resonated with me. She talked about how the care and the clinicians in the center work with more than 15,000 individuals with intellectual disabilities annually. And the school's dentistry program cares for more than 2,000 individuals with intellectual disability. So this is just one medical center in the country, one of 8, that houses a USED, LEND, and an IDDRC. So she reports that doctors and dentists at the center are especially skilled in working with Ian and other children who have autism or other intellectual disabilities. And I share this account because the research that's linked to training and practice is not only important for those who access it at the center, but thinking about those who are being trained in the type of, again, interdisciplinary practices focused on individuals with intellectual and developmental disabilities.
Yeah,
So important.
that's a great story. And I
Would
think
you
it's,
share the? Oh,
oh,
go
go
ahead.
ahead. Well, I was just going to comment. Our UCED land and IDDRC in Missouri, and we're very fortunate to have all three here. But they're all in different university campuses, and so we do partner and we do get to interact. But I think that must be really powerful when you're all in the same kind of location.
Yeah. I was just going to ask if you'd share a story from your home you said in Wyoming. You mentioned you had a good impact story from there too. I'd be curious to hear.
Sure, it's one I think about and I've used quite a bit over time. But a family came to us in the assistive technology program that was housed, the state's assistive technology act program that's housed in the USAID. And they live in a very rural community. I would say the population is probably less than 1,000, and it's in the mountains. And they brought their son Jack, who was a toddler at the time. And Jack is blind. He was born blind. And they came just to seek out maybe some assistive technology devices or something that could be helpful to him. Well, our therapists, we have several, and assistive technology specialists, they recommended a number of devices for Jack and strategies for him, for his family. And then they worked with his therapists because they work in these rural communities without ongoing training or often without collaboration with others in their field. And they worked with his team of early childhood teachers who were supporting him and to be able to navigate his home and his community and to learn so that he could begin early childhood education and become as independent as possible. So the strength when I think about this, the strength of the DD Act and the AUCD programs is that through ongoing research, education, training, and services, he's now a young man, received what was needed at every evolving stage of his life. So the USAID was able to train different teams of teachers, different teams of therapists, and his family as he learned new skills and what might be next. And, again, at every stage of his life, he's now an independent adult. And then those professionals now have the skills to address, visual impairments should they see them again. And they are resources for the state now. His mother went back to school and she became a teacher of the visually impaired. So I just want to give you a quote because she did publish an article as a parent. And she said, I really feel that there are two reasons that my son is super lucky to live in this moment in time. The laws that have been passed because people have fought for them, and the science and technology that people have developed. So I thought that was a pertinent story to share.
Yeah, that's great. I love that. Um, so let's see. We do have time for if one more story. If you have another or something else that you can share that comes out of the network.
Sure. This is also highlighted in our annual report, but the Utah USID and LEND program at Utah State University Institute for Disability Research, Policy, and Practice started an early childhood home visit program, and it promotes family resilience and healthy child development through home visits, family connection groups, and access to helpful resources from the community. Again, this resonated with me as a parent. we had a few home visits, but primarily it was us taking our children to centers. And according to Tressa Johnson, the program administrator, it's about empowering parents with knowledge and helping them make informed decisions. And the focus of the program is on family well-being, supporting both parents and children. And these families can include first-time parents, military families, foster or temporary caregivers. And Johnson reported that having something research-based and evidence-based helps them build their family. The program supports child development and helps make sure the children are ready for school. So she added, we all wonder how to balance family and work, school and family, and this program helps. So again, this is about a program. This is about interdisciplinary information and care and supporting families and children to be as successful as possible.
So, as we kind of introduce this episode, the university centers on developmental disabilities, LENS, and programs like it are currently at risk in sort of as the federal government reorganizes the Department of Health and Human Services, and as they're looking at the upcoming congressional budgets and things like that, that some of these programs have been eliminated from the president's proposed budget. And so I'm wondering, Sandy, from where you sit, if you would be able to talk a little bit about what the loss of funding might mean for the disability community and beyond.
And I consulted with our policy team because I don't claim to be a policy guru. So, but a lot of what we've been talking about on the Hill, but also with other communications as well, is that the threats to the disability community are many, and they're coming from multiple fronts, administrative actions as well as from Congress. And our programs make up just a bit of the larger disability community ecosystem. And we believe that every policy is a disability policy. So, for example, cuts to the Supplemental Nutrition Assistance Program known as SNAP will negatively impact individuals with disabilities proportionately and likely at higher rates than the general population. Cuts to Medicaid could be significant, and these will negatively impact individuals with intellectual disabilities, not only related to their health care access, but potentially threatening the services and supports for them to live as independently as possible in the homes they choose. And then closing regional Social Security offices limits the access that individuals have to information and services. It just adds another layer of complexity. And then dismantling the Department of Education may reduce the availability and rigor of special education and related services. So the list goes on because every policy is a disability policy. And that sort of gets to you bringing up the 2026 proposed budget, and it's representative of the systemic threats facing the disability community and the services that are their lifelines to health, wellness, and self-determination. So for AUCD advocacy, first, we look at our programs. How can we support the USEDS, LENS, IDDRCs, as well as then our DD Act partners, because we're all contributors to the health and well-being of individuals. And then we take a step back even further to collaborate with the disability and aging more broadly, because the more we speak as one voice, the more impactful we can potentially be. So in terms of our programs, they're at risk of losing their funding, and that loss of funding would translate into numerous harms. Our programs do work, in addition to what we've spoken about already. They do workforce training. They provide services to the community. They support self-advocates and families, and they do life-saving research and more. So without our programs, we will lose decades of progress that has been made with and for and alongside people with developmental disabilities.
I think back to your impact story you told about the mother in Wyoming and just saying that she was grateful that her son was born in a time in which policy and technology sort of aligned so perfectly to provide him the opportunities he had now, and what a loss if policy takes us backwards.
Yes, and I think she was referring probably to the 1970s and 80s, but we are faced with similar situations again.
So when you think of our listeners, Sandy, especially those who may not know much about the DD network, what would you like for them to walk away understanding?
Mainly that the DD network and partners, it's about people. It's about doing the right thing for people. And, as I went through the Kennedy address to Congress and directions to the panel in preparation of with talking to you today, in 1963, President Kennedy said, "We must promote to the best of our ability and by all possible and appropriate means the mental and physical health of all our citizens." And George, I would say and argue that this remains true today.
Absolutely. Thank you for that. And then if people want to learn more about any of the topics that we've talked about or contact you, learn about AUCD or all of the above, how can they do that?
Best reach through email. I'm not a huge social media user, but AUCD.org, and you can find my contact information there.
All right. Well, thank you so much for taking this time to be with us and and be our inaugural person, expert for this series. We really appreciate it.
Well, the whole network is our experts. So thank you for the invitation. I appreciate the opportunity.
Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri UCED. Accessible is a joint project between the Missouri UCED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcasts. Join us next time to hear more insights and ideas from leaders in the disability world.